our organisations need to reflect our Catholic identity and our values. And they need to reflect the fact that we're continuing, our work is a continuation of the healing ministry of Jesus. And our organisations in Catholic Health are different, but they're all still grounded in the gospel values and reflect really the charism of our founders. One of the key ingredients in building a culture that reflects the gospel values is in our workforce. It is important that we develop a workforce that is able to reflect the type of service and care that we want to offer to our patients, residents and families, and also behave in a way that's consistent with each other. Our organisational culture is about our mission, but that's mainly conveyed through our people. And it's the people who have engagement with the people that we serve, our patients, residents and families, and with the staff who work together to ensure the continuation of our mission on a daily basis. So in reflecting the mission amongst our people, it's important that they are able to have ownership and have an involvement and an understanding of that mission, and that the mission reflects all aspects of our work. So for us at Cabrini, it's our promise, which is a building of our values and an understanding of the kind of behaviour that's acceptable in our organisation, which governs and underpins our day-to-day actions. So our behaviours that matter would talk about the type of behaviour that we would find acceptable in our organisation, and the type of behaviours that we would seek to develop in the staff that we have with us now and invite into our organisation in the future. So for us, that starts right from the recruitment. We need to advertise our positions in a way that reflects our Catholic identity. We need to be very clear about who we are and very clear about the kind of recruitment and the kind of people that we want to become part of our workforce. Another part of that that's important is our websites. We encourage people who might read our advertisements to look at our websites, and that says a lot about what it'll be like working in an organisation like ours. A part of our recruitment is about our interviewing. We need to be very clear and use the language right from the start when we invite people for interview, so that they understand, again, what it's going to be like working in an organisation like ours and what it is to be a part of a Catholic organisation. My first question when I'm interviewing potential candidates for Cabrini is, what do they know of Cabrini and what is it that brings them to apply in our organisation? I then like to talk to them about our mission and our values and their understanding of that at the outset. And I like to ask them to provide us with some examples about the times that they might have been involved in similar roles, what work they might have done in similar organisations, or some examples of times when they might have worked in a team that would require of them the contribution that we're going to expect at Cabrini. We can recruit for skill, but it's a very important part of the work that we do to recruit for mission and fit. So once becoming a member of the Cabrini family, it's important that we follow through with a very sound orientation process. Our orientation commences with the telling of our founding story, and they are very compelling stories, I'm sure, in all of our organisations. And in particular, I know in our orientation, I've never seen a bored person in the audience when they understand the journey that our organisation has travelled. The important part of orientation is to ensure that staff have a very clear picture of our vision and our mission and their part in that. And they also understand what's available for them and the support within the organisation for the work that they do. And it goes beyond the work life in understanding that we do provide services as a Catholic healthcare organisation that supports them even in their personal life. What's available for them from a developmental perspective, whether they're undertaking any sort of tertiary development with career aspirations, or the development of staff indeed at all levels, because development is important for staff no matter what role they undertake in the organisation. because everybody has a role to play, and it's important that they understand where that fits both within the structure from an operational perspective, but every role is important in the delivering of our mission, no matter what role they undertake in the organisation. They contribute in different ways, both operationally and from a mission perspective, but their interaction and support of the patient and the service are of equal value in the service that we provide. So our clinical staff have a relationship with the patient in a very specific way, but our staff who provide support services, they give an important understanding and demonstrable presence of the type of organisation that we are to the people that we serve. On our tours, on orientation, we had a lady who had long worked in our organisation, and she had a role in our medical imaging department, and you used to see her taking off with the orientation groups when she was assisting with orientation, and you'd see her wending her way through the basement. And of course, as with many of our organisations, in our basement is hotel services, food services, domestic services, logistics, and those sort of areas, engineering, all that support our services. And you'd often hear her disappearing up the corridor with a group of clinical staff, reminding them that they needed always to treat the people who worked in the areas that were in the basement with the utmost respect, because without their service, the work that they did couldn't continue. And it was a daily reminder of the fact that it doesn't matter what you do, it's a significant contribution to care of the patient or the resident. From time to time in our organisations, it's necessary for us to manage the performance of an employee, and it might be for an operational or a clinical aspect of their performance, but sometimes it is about a behaviour and an attitude, and that might manifest itself either in the service that they're offering or in the way that they behave within the team. It's never an easy task to undertake, but it's a very important aspect of what we do, because there's a great difficulty in talking about being aligned with mission and then having behaviours going on in the workplace that aren't reflective of that set of values that we espouse. So in managing the performance of a staff member, it's important to have a range of processes that are sound, that are built around justice and fairness, and that they're implemented in that way and then carried out in a way that offers support and opportunity for the employee to reflect on their performance and their behaviour to be able to improve. That we use all the tools that are at our disposal, whether it's our education processes or our support and mentorship, that's able to assist them to see if they're going to be able to develop a behaviour and a cultural fit that suits our organisation, or whether it's one of those areas where it's somebody on our workforce that's never going to fit the type of service or behaviour we expect within our organisation. A good example would be where you have a staff member who is regularly disruptive within the team, who is regularly dismissive of other staff, who carries out bullying behaviour within the team on a regular basis, who has had every opportunity to understand why that behaviour is not appropriate within a team and within our organisation, and has had every support to understand anything that might be contributing to that kind of behaviour, whether it's something that's reflective from their personal life or whether it's something that is causing a disruption from within the organisation. And the fairness and justice would expect that we would offer the opportunity for that person to correct that behaviour, but understanding that within our organisation there's not a place for that kind of attitude or behaviour. And under those circumstances, from time to time, it's necessary for us to make a decision that it's time that person moves on from our organisation, but it's also important that it's managed in a very fair and appropriate way. Another dimension of human resources is remuneration and recognition of our staff. We know that Catholic social teaching requires us to recognise fair reward of our staff, And most of us would be governed by processes like enterprise bargaining and enterprise agreements, and having a range of fair and equitable agreements across our organisation. But there is also another aspect to that, and that's recognising our staff as a whole person and their other needs and their desire for recognition. Catholic social teaching requires that we recognise staff as humans and not commodities, and recognising the work that they do and being able to thank them for the work that they do is very important. We have a range of celebrations across our organisation that assists us in doing that. We have our staff recognition ceremony annually that recognises the length of service of our staff, and we have our awards for staff, which are nominated by both staff and peers as well as by patients. And the recognition of our staff plays an important role in the work that they do. Human resources is about providing an environment where our staff come to offer the very best they can in the service that they provide, that they're empowered to develop and grow in the work that they do, and that all our processes support them in offering that care and service.